as the risk of climate change, like health threats goes up, a lot of communities are going to be impacted.
I think on the whole, we need to be thinking about the climate crisis as a health crisis.
More reaction following the latest assessment from the International Panel on Climate Change. The IPCC's report saying unless there are immediate, rapid and large-scale reductions in greenhouse gas emissions, limiting warming to close to 1.5 degrees Celsius or even 2 degrees Celsius will be beyond reach. Samantha Green, who's with the Canadian Association of Physicians for the Environment, now saying as the report predicts that warming to be increasingly likely, she wants to see healthcare adapted to serve associated needs.
People who are otherwise already suffering from chronic conditions, people who are elderly, small children, pregnant women suffer the most. We're already seeing a change in vector-borne diseases, and we're already seeing an effect on our access to food and food security.
Now, the IPCC report did also address what Green describes as a slight decrease in emissions during the pandemic, a time when most of the world nearly eliminated all travel while reducing production, leaving most economies severely strained.
The COVID-19 mitigation, where we all stayed home, that wasn't really systems change. Like, it was pretty much business as usual, except we didn't get to see our friends and family.
She says as the likelihood of more warming is predicted, she wants to see health impacts softened by beefing up forest fire response, indoor air ventilation, and more green spaces in hotter urban areas.
Targeted interventions for those who are most marginalized.
Where there are people that will be able to adapt readily, and there will be communities and people that will not be able to adapt readily.
It's a sentiment shared by Manvi Bala, founder of Shake Up the Establishment, a group she describes as being focused on climate justice.
So a lot of the time it's racialized communities, women and gender diverse folks, individuals with low income.
She also agrees adaptation efforts coming from the healthcare sector would be well placed.
Perfectly positioned sector to be increasing the resiliency of communities in the face of these emerging health threats.
And now, as the IPCC tells us to expect further warming, what other options are available? Scientists have long pondered deliberate interventions to engineer the climate or capture carbon back out of the atmosphere. They're concepts, however, that are usually regarded as coming with an element of risk.
In your opinion, is it time that we start looking at that what used to be thought of as risky, but now is the time we put that kind of stuff on the table?
I mean, everything is on the table because this is a climate emergency. And I think we need to do the simple stuff today that is very doable.
There is not going to be one pathway to the end. It's not going to be that suddenly we completely decarbonize our whole economy and we're good to go. That's really impractical. So in that way, we need things like carbon sequestration. How we do that, I think, is also on the table for debate.
In the meantime, just days after this latest report was published, the Canadian government announced it will be pursuing a national adaptation strategy. For City News, I'm David Zura.